Praxis is an electronic medical record program based not on templates, but on a unique technology that instantly searches for and displays the most similar encounter you have ever documented in your practice in relation to the one you're about to start on right now, so you may use that previous similar text to generate the current one at the speed of your mind. As a result, Praxis does 3 things for you that no other program can. All your medical writing becomes extraordinarily fast, faster even than your own speech. Your charting becomes progressively more complete and accurate, far better than your own handwritten notes. And your chart comes alive, and completes itself, and runs your practice, and becomes your best partner, and so many more things that we will show you now. Let's see our first patient.
Welcome to the main page of the patient in Praxis. As you can see here, there is a wealth of information on this first page. Up here at the top, next to the picture, you can see the patient's name, age, and registration number. Here we see the name of the assistant who triaged the patient for you, and the referring provider if there is one. Also, here are any allergic drug reactions that this patient suffers from. And finally, we see the patient insurance and plan information. Over on the right, there are 3 clocks that give us the information about the number of days that this patient waited for this appointment, the total amount of time that it took from the reception to the assistant, and then the total visit time with you, the provider. Here on the left, we see the problem list with the patient. Praxis generates this problem list by itself. You can see new, active, chronic, and resolved problems. And of course, you can edit this information whenever you wish. Over on the right, we have the assistant note, which can be included in your own note, and the vital signs in the patient, as well as any clinical parameters that you have set up in your clinic. And here on the lower right, we see what we like to call dynamic labels. These only appear if there's information underneath. You can click on these and look at any information that is contained in them.
So far, we have not seen anything dramatically different than what most good electronic medical records will show. It is when we begin to chart that Praxis first shows us its unparalleled ability to help us practice medicine by constantly improving our habits. Let's take a look at this by going to the New Visit window.
This is the New Visit window, the heart of Praxis EMR. From here you are going to manage not only your charting, but your entire clinic. When you first look at this window, it does not look that impressive. It looks pretty empty, a simple soap note. But first impressions are misleading. There is a powerful artificial intelligence engine called the concept processor inside the system, ready to help you. You notice the assistant note and all objective findings that are also taken by your assistant. Now please understand that when you are looking at all the content, that this is not meant to be your content, but in fact my content. Even if we were in the same specialty, you and I would still chart differently. Therefore, imagine your content instead of this. The logic you are going to see, however, is the same. For example, these are my objective findings. Your objective findings may be a little different than mine, or perhaps a lot different than mine. But think about how many times you have to write the same thing over and over again, or dictate it. In Praxis, you never have to write anything more than once, because Praxis memorizes everything you enter on the fly, so you don't have to repeat it in the future. This, for example, is my procedure report. This list should bother you. It should bother you for 2 reasons. First of all, because it is my list and not your list. But also because you are used to seeing things arranged in alphabetical order, and this list is sorted in order of frequency distribution, with the most frequent procedures listed at the top.
In fact, because I do so many demonstrations with Praxis, I have lots of cardiac arrests. Hopefully, this isn't how your box will look.
If I wanted to find an endoscopy, for example, all I have to do is type the letter E, and all the words that do not begin with the letter E are eliminated. Then I only need to add the letter N, and I can quickly find my endoscopies. If I want to find joint procedures, I just need to type the letter J, and Praxis quickly locates the word joint, even though it is the 3rd word in the line. If I wanted to suture a laceration, I followed the same procedure. As you can see, everything is very easy to find through the use of the search insert function. You also see that there is a list of common assessments I do in my practice. Again, this is in order of frequency distribution. Then there are all other elements, such as return visits, laboratories, and of course medications.
But how does Praxis help me chart at extraordinary speed? In fact, at the very speed of my mind. This bell-shaped curve represents your practice of medicine. Now you know that in your practice, some cases present more frequently than others. Some encounters are so rare that you've never seen them before. Others you see more than once a day. Whenever you see a case, only 3 possibilities exist. First, the encounter can be practically identical to one you've seen before. Second, an encounter can be similar but not identical to one you have seen in the past. And third, you may be dealing with a rare case, one you have never seen before. There are no other possibilities, and your current encounter has to fall within this curve. Now, if your current encounter is identical to one you've handled in the past, you are instantly done charting. Praxis will find your previous case and show it to you so you can generate your new case faster than you can speak. All you need to do is review it for yourself and with your patient, and you're done. In addition, Praxis will generate your prescriptions, lab orders, procedure reports, referrals, letters, instructions, excuse notes, and even a properly coded superbill, all at the same time as the chart, which means instantly. And of course, you can't argue with it. You wrote it yourself, albeit for a different patient at a different time. If the encounter is similar to a previous case, Praxis will instantly find it for you. You just make some edits to the previous text, which is surely faster than starting from scratch or from a boilerplate template, and Praxis generates the entire case and its associated documentation as before. In addition, Praxis will remember the changes you just made so that if in the future you see a case that falls in between these two, your changes will be reduced by a half, then by a quarter, and then by an eighth, etc. The more you use it, the faster it goes until you generate everything in seconds, because Praxis learns from you with every new encounter, getting faster and smarter every time. The quality of your documents and the quality of medicine you practice will continually improve by learning from your own past. This is the essence of the concept processor. It reproduces your own thoughts right when you need it and at the speed of your mind. Let's begin showing you how the concept processor works using a common encounter in primary care. A patient that comes in with a simple case of acute pharyngitis. I examine the patient and find that she has a fever and an inflamed pharynx. I also take a quick throat screen and find it positive for strep. She is allergic to penicillin, so I decide to treat her with erythromycin. The first step to be taken is to find the closest encounter in my system. A Praxis user may start from any point except the history. In this case, I choose to begin with the prescription. These are the medications used in my practice by frequency of presentation, with the most frequent medication always shown at the top. You will be able to see at a glance the drugs you use most often. To quickly locate any drug, I press the first letter of its name. For example, if I want to prescribe amoxicillin, I type the letter A, and if I still don't see it, I just press M. In this case, I select erythromycin, and Praxis goes into its artificial intelligence engine and looks for every single time I've used erythromycin on any patient, disclosing all the diagnoses applied for those encounters, again, by frequency of presentation, with acute pharyngitis heading the list. Of course, I don't treat acute pharyngitis in just one way. I treat it in many different ways. In fact, you might treat it in more ways than I do. The important thing is that you don't do anything randomly. You have your reasons. You might disagree with a colleague about a diagnosis or procedure, but you will never disagree with yourself. That personalized aspect of medicine is enhanced with the Praxis EMR. So, to find the closest encounter, or the closest way that I have handled pharyngitis in relation to the way I need to do it now, I simply click on the diagnosis and I immediately get a second list. These are personal keywords, each representing different types of encounters of acute pharyngitis I have treated in the past with erythromycin. Not shown in this list are the many more ways acute pharyngitis has been treated in the past without the use of erythromycin. I am now narrowing down to my closest encounter. Of course, because I created each of these keywords in the past, I know exactly what they represent, and so will you with your lists. I click on allergic, and Praxis reconstructs the entire closest encounter for me instantly. You can see that not only was the physical exam done instantly, but in fact my entire case, including any procedures, prescriptions, instructions to the patient, and so on, are also there, ready to print out. I'm almost done. Now that I have the closest encounter on the screen, let's go to part 2, how to edit it. This is the point where I do look at the history. The history, no matter how complex, is divided into symptoms, each one being a phrase with clarifying information or random variables such as the one we are looking at now. All I need to do here is to change the random variable by selecting options derived from previous cases. In addition, because these statements came from seeing other patients with similar conditions, many previously taken symptoms may not be germane in my patient today. If I do not highlight any symptom now, it will not be active. Only the things that I highlight will be printed today and will be saved in this patient's record. However, you can't forget to think of all the previously listed symptoms for these and future patients. Hence, the quality of history you will take is actually improved. Your own chart will prompt you to ask the right questions and check for the appropriate findings. The last logical possibility is that this patient, who I am seeing with acute pharyngitis allergic to penicillin, presents with a symptom I've never thought of asking about before. If I enter it now, I will also have it forever for use with other patients. You can see how the quality of history taking improves over time as you see more patients. While on the subject of data entry, you should know that typing is not your only option. You may also use speech or handwriting recognition, or even dictation transcription to enter text. Of course, the more you use Praxis, the less text you need to add no matter what method you use for actual data entry. For those rare cases where you do not know what history to start with, we have included a discussion on this topic in the frequently asked questions. Now at this point, I will exit the history, and the rest of the case is very straightforward. Everything, including the plan, is already done for me exactly the way I did it last time for my closest patient. Now all I need to do is change whatever is not appropriate for this encounter, and I'm done. Notice that this is a well-developed, well-nourished female. If this had been a male, all the females get automatically turned into males, all the ladies into gentlemen's, and all the she's into he's. In this case, I do wish to enter the fact that the patient was strep positive, and this is very easy to do. Notice also that Praxis shows every abnormal description in bold. In this case, the patient did have nasal congestion, and that's very easy to change. This is a description that I had used before with another case. Now, moving into the prescription, I want to treat the nasal congestion as well, so I decide to use Sudafed. I've used Sudafed in the past, so, again, it's very easy to select it. If I had not used it previously, I could easily find it from the full drug pharmacopoeia that comes with Praxis. Of course, all these medications will be printed in separate prescriptions as soon as I finish the note. It's important for us to take a look at the patient's instructions. Simply clicking on them will show us the separate text that will turn into a handout that prints out when I'm done here. I am basically done with all of my documentation, and now I save it and print everything that I need. I click on Save with Knowledge, and I am immediately prompted for a change in my assessment. This is very interesting. Note that the diagnosis would remain the same, acute pharyngitis. However, I may add a new keyword of my choice, such as congested. Indeed, this automatically creates a new variation on my standard treatment for acute pharyngitis for a patient who also presents with nasal congestion. When a patient is congested, I will also describe the history, physical findings, and add Sudafed. The number and kinds of keywords can be as large as I wish, but they all remain invisible from the rest of the world. The world will only see the words acute pharyngitis, but I will find this variation in the future with great ease. In fact, acute pharyngitis will now be an option when I select nasal congestion for other patients or when I prescribe Sudafed. This is neural network thinking, and this is exactly how our minds work. For congested allergic patients, not only would I give the previous medications, but I would also describe the congestion, and I would treat it with Sudafed as I've just done. It is as simple as that. Praxis has learned my way of thinking, and it can learn your way of thinking. Okay, let's save the case now. And this is the report generator, which automates everything else. It prints the prescriptions and other documents as taken from the SOAP note, such as the handouts you can give your patient, and it even intelligently superbills any encounter, as you will see later on. In addition, you may sign this note electronically so it cannot be altered. And we're done. Of course, with a bit of experience, this entire procedure you have seen can be done in under 40 seconds. Okay, let's see our next patient.
Let's say that a few days after I worked on Mary Imaginary's case, I see Daniel Smith, a 14-year-old boy who presents with the same symptoms as Mary, that is, severe fever, painful sore throat, positive strep screen, congested nose, and an allergy to penicillin. How would Praxis chart this case if I have already done the same case in the past? I would most likely handle the case in the same way as I did before for Mary, but now, Praxis will do it for me much faster than I could myself. Let's go to the new visit. This time I choose to start with objective. Again, how you start to find your closest encounter does not really matter, except you may not start from the history. You usually want to start from the most obvious part of the case, which could be the congested nose, or a given treatment or procedure you will be doing today. Under objective findings, I see nose, and select congestion. Immediately, Praxis looks for all of the encounters in which I have described nasal congestion in the past, and it displays acute pharyngitis. As this patient is also allergic to penicillin, I select allergic, and I happen to end up with the same case as I did for Mary, although I do not need to remember that. Entering the history of present illness, I see the same history I took before on Mary, including the information I entered last time, only now the duration is only 2 days instead of 3. In addition, I see that the word "this gentleman," changed from "this lady," may not really be appropriate for Daniel, who is just a young boy. I can fix this quite easily now, and it will remain fixed forever. Just the word "young," and there it is. In fact, not only do I have the option "young" for use from now on, but I also get the option "older" for cases where that may be more appropriate. Or I can leave it as a default, using the null option for patients that are found in between these two age groups. A few more selections here, and I'm done. Now I can review the rest of the physical examination, and as I do that, I find that the patient was seen before, and I can activate his previous review of systems. Immediately I can see Daniel Smith's specific review of systems brought forward from previous encounters. I spot the history of asthma and the significant sore throats he's had in the past. Although this text initially came from my knowledge base, once used on Daniel Smith, it remains with him with all the changes I make for him, now and in the future. In other words, changes made for this patient will not be used for any other patient. In this way, Praxis merges what belongs with this patient with what comes from my knowledge base. Text that comes from the patient remains in blue so as not to confuse me. I continue down the chart, the remainder of which is very similar to what I entered for Mary Imaginary a few weeks before. In this case, the nares are severely congested, and the gabs are positive as well. Notice, as in the case of Mary, that I have given the patient Sudafed. I can make sure that the dosages are appropriate for this boy, or I can change them as needed. Praxis will save the dosage I choose for the patient today, so next time I won't have to change it. Now we'll examine the patient further. Always a good idea. I find he's wheezing significantly. Remember his history of asthma? In fact, Daniel is presenting with 2 diagnoses this time. So how does Praxis handle a multiple assessment situation? Well, first I'll click on Multiple Assessment. Then I'll click on the chest label and select Wheezing. As usual, Praxis goes into its artificial intelligence engine and looks for all the previous encounters where I described wheezing in the past. It then shows me the diagnoses that were used for those other occasions. On top is asthma. I'll select a severe variation of it. And now I simply edit the mixtures as they take place, and I'm done. I can also see that the remaining body regions have interpolated, and the abnormal findings have replaced the normal findings automatically. All I need to do now is review the note with the patient to make sure the text truly represents the patient's actual condition. I can see that there is significant wheezing bilaterally, that the heart shows regular rhythm with tachycardia, because most asthmatics are tachycardic, and that significant cyanosis is apparent. On the other hand, say I didn't really examine the extremities. I can remove it with a simple click of the mouse. If I didn't examine the neurologic, I'd just do the same thing. Isn't it far easier to remove what you didn't do than have to remind yourself and then type what you did do? Going to the history, I see that the second part of the history has combined with the first part, but that the family history text is mutually exclusive. I have seen patients with a positive family history for asthma and those with a negative history. There's no way to tell in advance how the history is going to turn out. I have to ask the patient for that information. The nice thing is that I will never forget to ask. That's the power of Praxis. If I ask the patient about family history and he tells me that his father suffered from asthma, I would enter that information now and finish the history. Finally, look at the medications. I can see that all the medications for asthma have been added to all the medications for pharyngitis, so all I need to do now is review them. I decide not to prescribe theater, so I remove it from the list quite easily by simply double-clicking on it. Note that I can also have any complex treatment therapy for Daniel if needed. Finally, I'll take a good look at the instructions. Not only has the fever instruction been generated, but so has the asthma instruction. In addition, both of them will be given with the handout to the patient. All my writing is done. All that remains for me to do is exit the record. As I do that, I look at the routing slip and see that all the CPTs are linked appropriately to the ICD-9s. This was a level 4 visit before I removed the neurologic and extremities, so don't remove them. Simply examine your patient as you told yourself to do so. Of course, examining your patient is far easier than writing about it, and you can then code properly. This will not only remind you of what you had to do for this visit's examination, but you will also be able to legally charge at the higher level of service as allowed for this type of case. Now we can exit, and Praxis will automatically print all or part of the documentation, including the prescriptions I have generated for this visit, right from my prescription blank that it will create at the same time. You have seen how much faster my second case of acute pharyngitis was than my first. In fact, that's the whole idea behind the concept processor. The more you use Praxis, the faster, better, and easier it gets.
Most clinical errors don't happen with the rare cases. When you see a rare case, you are not likely to make an error. You are wide awake, you have your consultants with you, and you might even admit the patient to the hospital. In your everyday and most common cases, however, you face a different situation. These cases have become routine for you, and therefore they easily lead to simple and correctable mistakes. How many times have you forgotten to order a test, check a finding, or ask an important question? After all, you're only human. Praxis will prevent you from making these mistakes. With Praxis, you can use your chart the way a pilot uses a checklist to make sure that nothing is forgotten or overlooked, that all your T's are crossed and all your I's are dotted. The fact is, if you did it right before, you cannot make a mistake now. And if you correct a mistake now, you will not repeat it in the future. You will never forget to document fully, ask questions, or write unusual orders. Your stress goes down while the quality of your practice goes up. With Praxis, you become more and more effective as time goes on. As you know, medicine is constantly changing, and one of our greatest difficulties is to change our own habits. Praxis allows you to easily incorporate and organize new information that you acquire and make it available for quick reference for you at any time in the future, while you are with a patient or even at 3 o'clock in the morning. Your colleagues will be astounded that you can have such quick access to such a wide breadth of information. Thus, the quality of the medicine you practice consistently gets better as your knowledge base expands and your own habits are changed for the better. In the next section, we will discuss and demonstrate many more areas of Praxis that you may be particularly interested in. However, there is something to be said for the intangible here, which is your quality of life. Much of the stress in your professional work is needless and is the result of myriad reminders and details that you need to keep track of daily. The computer is a marvelous way to ease up on this burden and liberate you to also be human and to rediscover what brought you into this wonderful field in the first place. Well, now you've seen the basics. Praxis saves you 2 to 3 hours per day of writing time. It enhances the quality of patient care by improving documentation that guides you along by learning from yourself. It reduces stress and worry, gets you home early, and improves your quality of life. And of course, it increases per-patient reimbursement at the same time. You must have a lot of questions right now, since most of this technology must be new to you. Fortunately, many of the questions you're thinking of right now have probably been asked hundreds of times in the past by clients, and here we have some answers for them. All you need to do now is to find your question, and there will be an in-depth demonstration of that feature within Praxis. Note that these questions are sorted in order of importance, i.e., how often someone new to Praxis has asked it after seeing the demo. Although we go into detailed answers for each of these questions, if you're not satisfied after viewing the demonstration, please do not hesitate to call us, and we will be happy to answer any doubt that you might have.